The prominence of the pectoral muscles probably also is a reflection of how this horse has been working. This horse was worked with a very short neck carriage and was unable to properly engage the muscles of the thoracic girdle, and as a consequence was overly using the pectoral muscles, overly using the sternocephalicus muscles, so they had overdeveloped as a consequence. Whenever we're looking at the horse, we must be asking the question, is the horse imbalanced? Does the front end match the back end? In this horse, the neck muscles are reasonably well developed. However, the muscles of the thoracolumbar and pelvic regions are relatively poorly developed. This horse had chronic suspensory branch injuries and would consistently work with its head way above the bit, that is the front of the head being in front of the vertical, with the thoracolumbar sacral region in extension and lack of engagement of the hind limbs. I think it's important to be aware that there are many horses which have asymmetry in their osseous structures. In the horse on the left, we can see obvious asymmetry in the region of the tuberosity and asymmetrical development of the muscles adjacent to the tail. The osseous specimens on the right are from 3 different horses which had clinical evidence of lumbosacroiliac joint region pain. In the top image, we can see marked asymmetry of the sacrum with greater curvature on the side to the right of the image. In the bottom left image, we can see clear asymmetry in both size and orientation of the articular process joints of the 6th lumbar vertebrae. And in the bottom right image labelled B, this is a different horse with clear asymmetry of the articular processes of the 6th lumbar vertebrae. It is highly likely that these osseous asymmetries will predispose to abnormal biomechanical dysfunction and potentially result in pain-related problems. And here again, we can see a different view of the tuberosity region in the horse on the left. The patterns of muscle atrophy may be a good indicator in some horses of the primary source of pain causing lameness. In the caudal image on the left, we can see that there is diffuse atrophy of the pelvic muscles, the biceps femoral muscles, and the muscles to the right of the tail head. This atrophy of the muscles to the right of the tail head is more obvious in the 2 images to the right. This is atrophy of the semitendinosus muscle in association with a chronic fracture of the tuber ischium on the right side. In this horse, we can see that it's got a rather short neck conformation. The epaxial muscles in the thoracolumbar region are not particularly well developed, and we have asymmetry of the tuberous sacrali as indicated by the arrows. Also, the left hind quarter is slightly less well muscled than the right. When we're looking at muscle atrophy, I think it is important to look at what muscle groups are involved and ask the question, is the muscle atrophy proportional to the degree and the duration of the lameness?